Medical moment with more people getting vaccinated. What's the message for people who are still hesitant to get the shot?
Well, today we are joined by Dr. Michael Chang, who is the Chief Medical Officer for USA Health. Dr. Chang, thanks for joining us. What would you say to someone still on the fence about getting the COVID-19 vaccine?
Well, I think it's really important for several reasons to go ahead and get vaccinated. Number one, we know it's safe. Number two, it's important to protect yourself. And number three, it's important for you to protect those around you, whether it's in your home, your family, your friends, or at work. And it may very well be key to keeping your business open in the work environment.
You know, especially on social media, doctor, we have these stories of someone gets sick or they die after getting a COVID shot, and it seems like immediately there's a cause and effect that's made there. Is that frustrating to you when you hear about these stories and being spread so much on social media?
Well, you know, there's not a lot we can do to control what's going on social media. I will say, though, that the complication rate is remarkably low. It's absolutely safe. We've given out millions and millions of doses, you know, over 50 million doses nationally, and it's the right thing to do, and it's the safe thing to do for our society. I will say that if we don't reach a point across the country where we get close to enough people vaccinated to have herd immunity, this disease is going to hang around even longer and longer. So, you know, it's a race right now between the more infectious variants and how fast we can get vaccinated.
Yeah, it is frightening to think that this could continue to go on if people do not get vaccinated. What do you say to people who may have already had COVID-19 and think they don't need to get the vaccine?
I think you do need to get vaccinated because, number one, we don't know how long the immunity you get from having the infection will last. Maybe 3 months or so, maybe longer, we don't know. With the vaccine, though, we do know that you're protected for at least 6 months to even longer, probably a year or 2 years, and you may or may not need booster shots, but if it's done in a controlled way, you know you have credible and reliable immunity to the virus, and that's so important as the mutated forms are becoming more and more prevalent in our society.
Doctor, I still hear a lot of people saying, look, I want to get Pfizer, I want to get Moderna, I want the one and done Johnson & Johnson. What's your advice? Is it still get whatever you can get as quickly as possible?
Whichever one of those 3 shots is available to you is the safest shot to get. You should get whichever one of the 3 you can. It will protect you from dying. It will protect those around you from getting infected. Any one of those 3 is perfectly good.
All right, Dr. Michael Chang with USA Health, the Chief Medical Officer. Thank you so much for joining us tonight.
You're welcome.
And a quick reminder, WKRG News 5 and USA Health holding a vaccination clinic tomorrow here at WKRG News 5 Studios. That's 555 Broadcast Drive, just off of Bel Air, across from Target. This is a drive-through clinic. It's Pfizer from noon to 5. It's for anyone who's at least 16 years old with a valid ID. No appointment is necessary.